A PPO is a healthcare plan benefit that allows members to receive care by network and non-network providers. In many cases, members will receive a higher level of benefits for using a network provider. The university is introducing Accountable Health Partners providers, a subset of the Aetna and Excellus national networks, as a choice and opportunity for you to experience lower cost sharing under your plan, lower deductible, coinsurance, copays, and out-of-pocket maximum. Accountable Health Partners is a newly formed provider panel made up of University of Rochester Medical Faculty Group providers and carefully selected community providers. Each time you receive care, you select the provider of your choice. You have the option to use Accountable Health Partners providers, use any Aetna Excellus national network provider, use out-of-network providers, or use any combination of providers, Accountable Health Partners, Aetna Excellus national networks, or out-of-network providers. Your PPO plan includes single and family annual deductibles and out-of-pocket maximums for inpatient, outpatient, urgent care, and emergency room services. The annual family deductible includes embedded single deductibles. When covering dependents on the plan, once one member satisfies the single deductible, the plan will begin to reimburse eligible health care expenses for that family member at the respective coinsurance level for services received. Alternatively, if your family collectively satisfies the family deductible before satisfying each embedded single deductible, the health care plan will begin reimbursing eligible health care expenses for the family at the respective coinsurance level for services received. The same rules apply to the out-of-pocket maximum. For example, if you have 5 family members on your PPO plan and you all receive services from Accountable Health Partners providers, you receive services and satisfy your $400 single deductible, the plan will begin to pay coinsurance for any of your covered services for the remainder of the calendar year. If your spouse receives services and also satisfies her $400 single deductible, the plan will begin to pay coinsurance for her covered services for the remainder of the calendar year. Now, both you and your spouse have moved to the coinsurance phase even though you have not yet met the family deductible. However, the amount that applied to each of your single deductibles will also count towards the family deductible, satisfying $800 of the $1,000 family deductible. Now, one of your children receives services and satisfies the remaining $200 left in the family deductible. Once the family deductible is satisfied, all covered family members will be subject to coinsurance with no further deductible requirements, assuming all care is received by Accountable Health Partner providers. The same concept would hold true for services received from the Aetna Excellus national network as well as for out-of-network services. Coinsurance is the percentage that the plan pays for certain covered services once the annual deductible has been satisfied. Depending on whether services are sought by the Accountable Health Partners providers, Aetna Excellus national network, or out-of-network providers, the coinsurance reimbursement rates are 90%, 80%, and 60% respectively. A copay is the fixed dollar amount you pay at the point of service and is not subject to the annual deductible. For primary care office visits with an AHP provider, the copay is $15, and with an Aetna Excellus national network provider, the copay is $30. Specialist visit copays with an AHP provider are $30, and the specialist copay for providers in the Aetna Excellus national network is $60. The annual out-of-pocket maximum is the most you will pay for covered services during the calendar year. If you meet the out-of-pocket maximum, the plan will pay 100% of the covered services for the remainder of the calendar year. Your deductible, coinsurance, and copays, both medical and pharmacy, apply towards your out-of-pocket maximum. Here is a breakdown of how some services are covered. Preventative services are covered at 100%. The deductibles and out-of-pocket maximums cross-apply. This is important if you receive a combination of services from Accountable Health Partners providers and Aetna Excellus national network providers. Primary care and specialist office visits require a copay. Inpatient, outpatient, including labs and imaging services, urgent care, and emergency room visits are subject to the deductible and coinsurance. Retail prescription drugs, up to 30 days supply, are covered by a combination of copays and coinsurance. $10 copay for generic drugs, 20% coinsurance, $25 minimum, $50 maximum, for preferred brand drugs, 35% coinsurance, $45 minimum, $90 maximum for non-preferred brand drugs. Mail order, up to 90 days supply, is covered 2.5 times retail. Please review the plan comparison chart on the benefits website for additional information. Your share of the health care plan premium is determined by the plan you elect, your covered dependents, and your salary band. Your share of the premiums will be taken as a pre-tax payroll deduction. If you enroll in the Your PPO plan, you're eligible to elect a healthcare flexible spending account which you would use to reimburse yourself for qualified out-of-pocket medical, dental, and vision expenses with tax-free dollars. A healthcare flexible spending account allows you to save money by making pre-tax payroll contributions into your FSA, and when you reimburse yourself for qualified expenses, your distributions are also tax-free. Please view the Healthcare Flexible Spending Account video and read the Tax Advantage Account booklets for additional information. The ALEX tool on the video page of the benefits website is an interactive tool that can assist you in understanding and choosing the plan that best fits your needs. The plan booklets, your HSA eligible plan, PPO plan, and Tax Advantage Accounts booklets are available on the benefits website and will provide more in-depth information on how the plans work and what you should think about when making your elections. The plan comparison chart, also available on the benefits website, compares the coverage for certain services under the Your PPO plan and the Your HSA eligible plan.